So one area that I think there's been a lot of progress in has been this issue of kind of medical prevention or pre-exposure prophylaxis or PrEP. Can you start us talking about PrEP? Because I think that's a really interesting topic and we have some time to talk about it.
Yeah, so it's one of my favorite topics. It is an incredibly exciting time in HIV prevention because we have some very, very efficacious tools that we can offer people beyond just behavioral interventions that were traditionally just condoms, abstinence, reducing your number of partners, et cetera. But we now have one pill once a day, which is the medication emtricitabine and tenofovir, or Truvada, is the brand name that is FDA approved to take for HIV prevention. It's offered on a daily basis right now are the recommendations, although in other countries they're using different dosing regimens that are on demand around the time of sexual activity. But in the US, the guidelines are recommended for just daily dosing. And it is more than 90% effective at preventing HIV infection as long as someone takes at least 4 pills a week for gay men and probably more for women. And so it's a very, very useful tool for people that are at risk for HIV infection.
And is it getting used, or what's happening? Like Eric in Los Angeles, I mean.
Depends on where you are in Los Angeles.
Really?
There's a lot of pilot projects. There's a lot of access. I mean, it's available. Almost all insurance companies are paying for it. Medi-Cal, or Medicaid, is paying for it. So there's a lot of access. But the population of people that we're targeting are not seen by us. Right. They're seen by people in primary care practices.
Or not at all.
Or not at all.
Or not engaged in medical care.
Yeah. So those are the people that this message is so important for, right? This is easy to take. It's well tolerated. It's not complex like managing antiretroviral therapy infected people, and that we need to make it as easy as possible. There are guidelines that have been recently updated that provide somebody a cookbook as to how they can give it, and all they need to do is recognize who this high-risk population is. And the guidelines outline that, but there's nothing magical about it. It's high-risk men who have sex with men, who are not using condoms, who have partners of unknown status, people who've had recent STDs, and high-risk heterosexual women who are having sex with individuals who are at high risk or using needles or things like that.
Which I think that group is particularly hard to identify because sometimes women are not aware what their partners are doing. But still, it's something to keep in mind, especially if you live in a high incidence area. Things like poverty and other socioeconomic disadvantage, drives infection rates. And so recognizing if you're practicing in those types of areas that your patients who may not realize they are at risk might actually be at risk.
Yeah, we've used frequent visits for post-exposure prophylaxis as a clue for identifying people who should be now recommended to be on PrEP, and certainly anybody who presents with another STI is somebody to do that. I think the two challenges really are that most healthy young men are not in any kind of medical care, right? And the second is that we really need to make primary care physicians much more comfortable about prescribing PrEP. First, ascertaining risk and then acting on risk by prescribing PrEP. We see a lot of patients in referral for should this person get PrEP, and then we help co-manage them. But obviously, we don't see most of the healthy, uninfected people.